Dr. Uttara, and I'm a PhD in genetics, and I'm attached to MyGene DX. We'll start the program with an invocation song. எத்தனை கோடி இன்பம் வைத்தாய் எங்கள் இறைவா, எத்தனை கோடி இன்பம் வைத்தாய் எங்கள் இறைவா, 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 எத்தனை கோடி இன்பம் வைத்தாய் எங்கள் இறைவா. சித்துடன் அச்சித்தினை இணைத்தாய் அங்கு சேருமை பூதத்து வியனுலகமைத்தாய், அத்தனை உலகமும் வர்ண களஞ்சியமாக பல பலனல் அழகுகள் சமைத்தாய், எத்தனை கோடி இன்பம் வைத்தாய். முக்தி என்றொரு நீலை வகுத்தாய் அங்கு முழுதினையும் உணரும் உணர்வமைத்தாய், பக்தி என்றொரு நீலை வகுத்தாய் எங்கள் பரமா 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 பரமா, எத்தனை கோடி இன்பம் வைத்தாய் எங்கள் இறைவா, 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 எத்தனை கோடி இன்பம் வைத்தாய் எங்கள் இறைவா. Handing over the proceedings to Dr. Krishna Kumar.
Thank you, Uttara. That was really a melodious one. A very good start for a wonderful session on low vision awareness program. I take this opportunity to invite each one of the audience who showed a great interest in this aspect of vision care, and also our expert panelists who have from, despite the busy schedule from all over the world, we have with us to answer to only the questions which have been come from people who have challenges in their day-to-day activity because of vision. It is very overwhelming response. We got almost 60 odd questions from people. That means the need of the hour to answer to those questions is enormous. And during this 1.5 hour session, if we could answer to large extent most of the question, and please understand that we have only short time of 1.5 hours to answer, I think that will be of great doing. So already I shared your questions with our experts so that we can ensure that it can be very short and sweet. And if you have as an audience more such questions or clarification required, please don't hesitate to write to our email or our contact details which already been shared with you. So with this introduction, I would like to share with you the program will be fast. There will be an introduction of all the panel members by me, following which there will be a 1-minute introductory remark about the program by each of the panelists, which will be followed by I will be moderating a question and answer session, wherein I will be reading out the questions for the benefit of each panelist as well as the audience, and you will be getting the answers. Please kindly be attentive to ensure that all the questions who have been given to us are being answered to the large extent. If not, as I told before, please don't feel bad. You can always approach us in our contact details. I think one kind information I want to reiterate, especially to the audience, panelists or experts are very much indeed used to have some of the common terminologies being practiced in our medical terminologies being in practice. Sometimes some of the words not been intentionally mentioned, please don't take it other way. We are here only to see that your questions are being answered to the perfect. With this introduction, I would like to take you to the details of each of the panelists whom you are going to interact with. This is first and foremost is the key brain behind this whole session. We had a similar session for ICAP professional on September 5th. Professor G. Kumaramanikwel, who is the managing director of MyGenDeck DX Private Limited India. He is trained in India, United States of America, New Zealand, and works extensively in the area of genetics. He has got extensive research as well as clinical experiences, and he has seen almost and counseled almost 12,000 genetic disorder patients. And that is the value of experience he has got, which he wants to share and answer to the questions raised by each one of them, each one of you. And we have another eminent ophthalmologist whose passion is enormous in the area of promoting vision rehabilitation. And always he highlighted the importance of rehabilitation as part of eye care services. He being an ophthalmologist practicing as a medical director in Trinetra Eye Care, Mahalingapuram, Chennai, who is also former director of oculoplasty orbit trauma at Shankar Netralaya. His experience is enormous. He has handled so many patients and also guided them appropriately for various rehabilitation measures. He is going to be with us answering some of the very key important questions for all our benefit. We have another wonderful person, Dr. Bhavani Iyer, who is a practicing optometrist, low vision specialist, and rehabilitation expert. Director Dan Arnold Center for Vision Rehabilitation from USA is also associated professor, the University of Texas Health Science Center, Houston, Texas. She has got more than 20 years of experience in rehabilitation. She's going to be with us answering to very key questions. And because of her time constraint, she will be with us for next 1 hour, and we will ensure that most of the questions have been answered by her during that time. Next, we have a young person from Mumbai who is a practicing rehabilitation from low vision specialist, Ms. Yogita L. Rajgandhi. She will be joining shortly. At present, she is very busy with one of the patients. So she will be joining us. She will be sharing and she will be answering questions from the Indian perspective with her experience in this field for more than 15 years. And she is at present the consulting optometrist and faculty. She is also the president of one of the key NGOs who is dealing with glasses as well as rehabilitation measures of Indian chapter. And she's also managing director of one of the low vision care rehabilitation centers in Mumbai. And we have another person, Mr. B. Vijay Kumar. He's advocate, and he also a national award winner for the best self-employed visually impaired 2005 from Government of India. He will be joining at any point of time. He will be here advising on various legal aspects and also sharing some of his experience. He's the honorary secretary of National Association for the Blind, and he will be giving a lot of inputs, which is very, very essential for most of the questions which you asked. And we have another important person, Dr. J. Vijayalakshmi. I understand some of the audience already knew her and her wonderful work at NIBMED. She is a medical consultant and has got more than 30 years of experience in the field of rehabilitation. By qualifications, she is a doctor with diploma in pediatrics. She has trained herself in the multidisciplinary rehabilitation initiative from Netherlands and from UK. And she is responsible of rehabilitating many families and also has shared her knowledge widely in India and throughout the various forums. So with this, I have myself, I'm an optometrist by profession with a keen interest in low vision care and rehabilitation initiative. I was previously with Shankar Netralia. At present, I am doing more of freelance optometry and I'm also practicing educationist. And the key person behind most of this work is all of you know would have communicated with Mr. Mahalingam, who is TwinTech Academy head, as the managing director of TwinTech Academy. He is the key person, like Dr. Kumaramanikvel, who made this thing possible to go through online this wonderful session on low vision care awareness program. With this panelist introduction, I would like to take you to the next step, to request each of the panelists to give an introductory remark before we take up the questions from the audience, which I will be moderating. So may I request Dr. Kumaramanikvel to tell a few words as an introductory remark.
Yeah, thank you, Dr. Krishna Kumar, and of course, Mr. Mahalingam and Dr. Ravindra Mohan for making this meeting possible, and of course, rest of the faculties who have joined today. So we deal with patients who have genetic disorders, and there are many issues where certain disorders can be inherited in families. And in India, and particularly southern India, we have a marital practice or marriage practice called as consanguineous marriages, where we marry within our very close relatives, blood relatives, uncle, niece, or first cousins, and so on. So this adds a very different dimension to the genetic problems in this part of the world, and also that some of these disorders have social concussions, and which is very, very unique to our part of the world. And therefore, we have experience of properly guiding people with genetic disorders to the appropriate experts so that they live a very normal life. And then we also access them to all kinds of new therapies and also research that is going on. And that's our strength. And we'll discuss that in today's meeting.
Okay, thank you, Dr. Kumar Manikwel. May I request Dr. Ravindra Mohan?
Yeah. Thank you, Dr. KK. I think the aim of today's session is going to be to try and actually practically answer some questions that are coming from real patients who have been finding difficulty in getting answers to some of their questions. As an ophthalmologist, I will try my level best to try and guide them to be able to seek the appropriate care. And also, in general, the low vision aids and rehabilitation of visually handicapped individuals is certainly an area which has been neglected both in the curriculum in eye care, especially in ophthalmology, and also it has it's yet to take off in the manner of many other areas of the specialty. So I think we must work towards that, of reaching out to more and more people and doing more in this field. So,
Thank you. Thank you, Dr. Ravindra Mohan. May I request Dr. Bhavani?
Hi, good morning, everybody. Well, good morning for me. Good evening for you all. Thank you to the panelists and the team for putting this together. I've been practicing low vision for at least 20 years now. And the one thing that I frequently hear from patients is, why didn't they send me here sooner? Why didn't somebody tell me about this sooner? So to that end, I think that we owe a word of gratitude to the team for putting this together to increase the awareness. So I'm looking forward to talking to you all and helping you answer those questions.
Okay. So thank you, Bhavani, for that wonderful introduction. May I request Ms. Yogita Rajgandhi to tell a few words?
Yeah, good evening, everybody. It's been a pleasure once again to connect with all of you, and I hope we can share the expertise. knowledge about the low vision to all the participants. So I look forward to sharing the knowledge with everyone. Thank you so much.
Thank you. So, Advocate Vijay Kumar, you are on there online now. Can you talk few words about
Unmute.
yourself?
Unmute.
Yeah,
Unmute. Yes, I'm here.
yeah,
I'm
Vijay Kumar.
online.
Yeah, yeah.
The thing is, for the 2018 Persons with Disabilities Act has come, but many people do not know about the act and what provisions does that act carry and what are the benefits due to the by virtue of that act people have, especially in the area of blindness and low vision. Therefore, I am ready to help the people whoever requires any help.
Okay.
You should tell your background, professional background.
My
Vijay Kumar.
professional background is that I myself am visually impaired person practicing for the past 30 years as an advocate in the High Court, handling cases in many areas, and I am also handling cases for the rights of the persons with disabilities. Is
Okay.
that okay?
Thank you, Vijay Kumar. I think there are few questions for you definitely. And may I
Okay.
request Dr. Vijayalakshmi uh, to share some key points which you before we take up questions.
Yeah, good evening, everybody. Actually, I'm Dr. Vijay Lakshmi, working for National Institute for Multiple Disabilities under the central government of India, and Social Justice and Empowerment Ministry. I've been working with these children with low vision right from 1992 onwards because I came to Clark School from Kerala to educate my son. So at that time, from Clark School, I went to Netherlands and also to London to specialize in deaf blindness, low vision, autism, and associated disabilities, multiple disabilities. So when I came back, I worked in Clark School for 14 years and I joined NIPMED in 2005 actually. And I started with working with all kinds of 21 disabilities are there according to PWD Act. And I started working with every one of them. And my favorite is deaf and blind and also visually impaired. Deaf blind, deaf hearing impaired, and visually impaired. So under visually impaired, they are classified into persons with blindness and to persons with low vision. So low vision, I really it's very difficult to assess them, but we send them because Dr. Krishna Kumar he's there. I know him from quite a long time. Even I know his teacher, Dr. Vaithalingam, and so I have sent them. We send for a low vision assessment. That is, we get the refraction and everything done, and when we come back, it will be written that the child is not able to see. But further assessment is done on a functional vision by our rehabilitation professionals and also me. And we give, we tell the parents about what problems they are really having. Though it is written that they are not able to see, but you can still work on their vision and develop them. So that is how I started working with children who are having low vision. And in fact, we could enhance their vision because with the help of Shankar Netralaya, they provided so many devices. And and that really helped many children to gain knowledge and to gain literacy. So what we do is they have some of them, if there is additional disability, they have difficulty in communication. So we tend to establish a rapport very slowly. We go along with the kids. When the kids are playing, we also play like them. Or when they are banging the head, we show our head and we play with them, and we establish a bond and rapport. And then only when we become very close to them, then only they also get attached to us. So what we do is we follow the kids. We follow the children with the low vision or deaf blindness or even any other kid with multiple disability. Follow the direction of the kid. Then the child will lead us to some activity. Then you can lead. First go with the child. That is how you establish the rapport. If the child is making a noise, clapping like that with the hands, we also do the same, so that he will listen to it that somebody is clapping like me, or somebody knows that he understands that we are interacting with them. So once you develop the rapport and bondage, then you work on their communication, because if you have low vision, they may not know the direction in which you are talking from, so you have to give the direction, the importance of communication. Sometimes they may need some extra devices, or they may need contrast background to find out that we are standing there. So you stand behind a wall, that gives a contrast that you are present there. Be close to them, and you have assessed the distance at which and the size at which they can see. If they can see very small objects, you can, when you are selecting toys, we used to select toys like very small, which can be seen by the child. So each and every child is unique. And when NIPMED was established, it took a long time to get the things for the children, toys for the children, equipments for the kids, and persons, adults and adolescents and everybody. Based on the unique needs, we had to plan to buy equipments and toys. So we bought bright color toys. We gave contrast everywhere, but not all contrasts are not possible, and the size of the object is very important, the distance at which you present the object. And we also ask the mothers and trainees who are studying there to make your own teaching learning material, so that it will be of low cost, but you are using the material that is present in the child's environment. So we and we make use of black and white lines, a lot of this orange and yellow and black and orange, green and white, black and white. So many combinations and all, one should visit, all rehabilitation centers have wonderful such contrast materials and toys and all. One should visit all these places to find out how to buy toys, how the trainees are making teaching learning materials, making use of the materials that are present at home, like the cooker washer, that can be the black ring, that rubber washer can be made use as a boundary for presenting your thing. So a child with low vision needs a boundary for presenting the thing, and which field you are going to present the thing. Like that, it was really a need-based work. And over 28 to 30 years, we have gathered materials that you just cannot throw away any material from my house. I never allow anybody to throw away low-cost materials from my house, and all that are made use of by the parents. We also stimulate the parents to buy low cost material. So இப்ப டாய்ஸ் எல்லாம் வாங்கணும்னா குழந்தைகளுக்கு கண்ணு தெரியற மாதிரி எவ்வளவு தெரியுமோ அவ்வளவு பெரிய டாய்ஸ் தான் எடுத்துக்கணும். இப்ப கையில எடுத்துக்கும் போது உங்களுக்கு பெரிய டாய் குழந்தையோட கையில நிக்குமா, இல்ல இந்த கலர்ல இந்த டிஸ்டன்ஸ்ல அந்த குழந்தைக்கு டாய் தெரியுமா, அதெல்லாம் நீங்க பார்த்துதான் டாய்ஸ் வாங்கணும். சோ சென்டர்ல வந்து பாத்தீங்கன்னா, இல்லாட்டி சங்கர் நேத்ராலயோட ட்ரைனிங் சென்டர்ஸ் இருக்கு, ரீஹாபிலிட்டேஷன் சென்டர்ஸ் இருக்கு. எங்க போனாலும் சரி, யூ கேன் ஃபைண்ட் அவுட் எந்த டைப் ஆஃப் டாய்ஸ் வாங்கினா உங்களால இந்த குழந்தைக்கு சொல்லி கொடுக்க முடியும். அதே மாதிரி மொல்லத்தான் ஒரு குழந்தை கூட நம்ம அட்ஜஸ்ட் பண்ண முடியும். சப்போர்ட், அது கூட ஒரு சப்போர்ட் டெவலப் பண்ணணும், ஒரு பாண்ட் டெவலப் பண்ணணும்னா நம்ம அந்த குழந்தை கூட சேர்ந்து விளையாடணும். விளையாடி அந்த குழந்தைக்கு புரியணும், நம்ம இவங்க கூட இருந்தா பத்திரமா இருப்போம். ஒரு ட்ரஸ்ட் டெவலப் பண்ணணும். நம்ம இந்த அம்மா கூட நம்ம கூட நடந்தோம்னா இவங்க நம்மள பாதுகாப்பா வச்சுப்பாங்கன்னு உள்ள ஒரு ட்ரஸ்ட் டெவலப் பண்ணணும். அப்பதான் அந்த குழந்தையும் உங்க கூட கம்யூனிகேட் பண்ண படிக்கும். சில டைம் என்ன ஆகும்னா, ஒரு சில செய்கைகள் காட்ட வேண்டி வரும். எல்லாருமே பிரிண்ட் புரிஞ்சுக்கணும்னு கிடையாது. இப்ப லோ விஷன் தான் சொல்லிட்டு பெரிய பிரிண்ட்ல லெட்டர் காட்டினா முடியாது. சம்டைம்ஸ் பிரெயில் வேண்டி இருக்கும். ஏன்னா அவ்வளவு ஃபாண்ட் புரியாத குழந்தைங்க இருப்பாங்க. சோ அவங்களுக்கு எவ்வளவு பெரிய பெரிய லெட்டர் எழுதினாலும் அவங்களால படிச்சுக்க முடியாது. சோ பிரெயில் கொடுக்கணும். சோ அதனால இது மாதிரி உள்ள ஒர்க் எல்லாம் தான் நாங்க பண்ணிட்டு இருக்கோம். கிருஷ்ணம சாருக்கும் குமாரமாணிக்கவேல் சாரும் எனக்கு ரொம்ப நல்லா தெரியும். நிப்மெடுக்கும் நம்மளோட நிறைய குழந்தைங்களுக்கும் இவங்க நிறைய ஹெல்ப் பண்ணிருக்காங்க. சோ தேங்க்யூ சார் ஃபார் கிவிங் மீ an opportunity.
Thank you ma'am. That I think in fact many of the questions have been answered through this thing. That's a very nice informative introductory thing. So now what I will do is, without much ado, I will try to directly share the questions to the panelists, and then we will take it up.
I have one point to raise actually.
Yeah, please sir.
So I think we should restrict our language to English, because we have people from Nagpur and various other northern India, Kolkata and so on.
Yes.
So
okay.
should, best we should keep the language as English, so
Okay.
that everybody understands. Thank you.
Mahalingam.
Thanks. Okay, thank you very much. I think
No, I
we
am
can
the class,
directly
na,
go
please.
to this panel discussion. We are have now left with
Personal
another
number.
1 hour for us. We will ensure that all the questions maximum been answered. Um, so we will go directly to the first question, and this is a very commonest question. A lot of patients are wondering. People say, doctor says you go to low vision department, or they say you have low vision. Can you just, Dr. Bhavani, can you answer from a layman's perspective, what is low vision?
அதையும் இப்ப சொல்றேன்னு கேக்குறேன்.
Okay, so low vision, a person is said to have low vision if their vision can no longer be corrected with eyeglasses, surgery, contact lenses, medications, any kind of medically available or readily available treatment cannot be used to correct their vision and restore it to 6 out of 6, which is typically what the terminology that they use in India. If your vision cannot be corrected further with traditional glasses, contact lenses, surgery, or medications, that's when a person is said to have low vision. For a layperson, what this means is you cannot go to your doctor and say, "Hey, I cannot see." If you put glasses on, then you can see. If you can see, then you're not low vision. If you put your glasses on and you still cannot see well, that is when we call it low vision. It can be decreased vision due to vision that you see straight ahead, or if your vision is decreased from your periphery because of glaucoma or any other kind of eye disease. So that is essentially what low vision is to a layperson.
Okay, thank you, Bhavani. That is very useful information. Dr. ERM sir, actually, maybe that is exactly following that one, second and third question. The two common questions people do ask is, okay, I know that I have this problem. What I need to do next immediately? And what are the common reasons for which this low vision usually I get? So maybe these two questions, if you can answer, that will be a very good thing to set forward.
So, in fact, whenever there is a doubt that the vision of, let us say, a young child or an adolescent or even an adult is less than, obviously one needs to start with a consultation, and one must see an eye doctor to evaluate the cause for this low vision. As we know that the eye is a complex structure, and the causes for this kind of a low vision can range from anything in the front of the eye, which is called the cornea, right up to the back of the eye, the nerve, or even the brain. So that finding out the cause for low vision and seeing, like Dr. Bhavani mentioned, making sure that nothing else is happening before we label it as low vision, which cannot be improved with any medical, surgical, or with glasses, the regular glasses. Then I think we must do a complete eye examination. I think that's the first step and the starting step, following which your doctor is going to tell you to meet a specialist who can help you with the low vision. So first, meet an eye doctor, get a complete examination, have a diagnosis, and also if it can be improved, of course, it does not fall into the domain of our topic today. But if it cannot be improved by the regular means, there is still a huge amount of hope and huge amount of help that can be rendered by the professionals we're going to meet over the course of the next 1 hour. And the causes are very variable, right? From the front of the eye, like the cornea or the front of the eye looks white instead of looking the normal color, right up to abnormal movements of the eye, and every part of the eye can be a cause for low vision. So I think that is what it is. So some of these are present from birth, some develop later, and some can be in adults or older persons as well.
Thank you, Dr. ARM. I think that is a very good information. And Bhavani, again, actually, now we know that there is a problem. Now the eye doctor has seen it, and usually they say, okay, you go to a specialist who deals with. Can you tell more about who is this low vision care specialist? and how do we come to know about them, and what are the roles and what I should expect when I go there? Whether I should expect treatment from them, or what exactly rehabilitation means. Can you tell more about it?
Sure. So low vision specialists can be either optometrists or in some cases ophthalmologists. We are regular eye doctors depending on which specialty it is, whether it's an optometrist or an ophthalmologist who does surgeries. But then we go on to take special training to do low vision care. But once you move into low vision specialty, the low vision specialist does not do a routine eye exam. The role of the low vision doctor is not to diagnose you. That diagnosis is taken care of by your ophthalmologist, whoever dilates your eyes, puts drops in your eyes, and checks you. That is their role. They are your treating doctor. If you need medications or if you need any kind of surgery, it's the role of your primary eye care doctor to do that. The low vision specialist will actually take your functional problems and provide you with functional remediation. How to, for instance, I'm having difficulty reading, or my child is having difficulty reading the chalkboard in the school. So those are all functional difficulties. So what we do is when a patient comes in, we actually take the diagnosis and the information given by their ophthalmologist to us that tells us, hey, this child or this person has this diagnosis. This is the vision we're expecting them to have. And then we create some realistic goals. We say, okay, here are the things that this person can do, and here are the things that this person will probably not be able to do. And establishing realistic goals is extremely important in setting up a good rehabilitation program for that particular patient. So not to dive too deep into it before we come to that question, but in general, that's what a low vision specialist does. So then once we are done with our care, then we transfer you back to your ophthalmologist so that the ophthalmologist can continue to care for you. A lot of times you may be on medications that you need to be managed that continue to be taken, even though you have low vision. So we kind of work as a team with the ophthalmologist or with the other groups. And that's essentially what a low vision specialist does. The role of a low vision specialist is not to treat your medical condition. The role of the low vision specialist is to treat your functional visual deficits.
Thank you.
How do we come to know about them? We come to know about them. Here in the US, there's a website where you can go and type in specialty wise and you can search. I'm not sure what resources are available in India, but your best local resource is going to be your own ophthalmologist. Ask your ophthalmologist, hey, you told me I have low vision. Who should I go to? Ask those questions. And I think that's where the awareness comes in.
Thank you, Dr. Bhavani. That's a very good introduction. And may I request Yogita?
Can I interrupt actually?
Please.
I just got a feedback that in the YouTube, there's only audio available and not the video. So I think Mahalingam has to look at it.
Sir, it is available. I am watching YouTube also.
Okay, because I got a comment that only audio is there. So
maybe you can help them out.
No, actually, but due to the time slack, it will be there slowly. It will be there.
Okay.
But Mahalingam sir, I'm also watching the YouTube simultaneously, but even I can't see the video.
Okay, I will look into that.
You can look into it. I think shall we go ahead, sir? Because we are having the audio.
Yes. No, this just I wanted to make sure that the video is available on YouTube share. Okay. Thank you.
And this question is to both Yogita and Vijayalakshmi, because in Indian context, we have two kinds of people. One is called low vision care specialist, who's an optometrist who's performing the job. And other we have called vision rehabilitation professional. So we don't know, as a patient, people were asking when I have to go to a low vision care specialist and when I have to go to vision rehabilitation professional. Can you say more about the difference between the two, maybe as a practitioner, Yogita, initially, maybe afterward, Dr. Vijayalakshmi. Yogita, you're there?
For the
Hello.
Yeah, please.
Yeah, as Dr. Bhavani said about optometrist job, ophthalmologist, and even the low vision specialist. So, low vision specialists do not do the optometry workup. They have a different kind of a workup for the functional vision assessment. So, once the low vision specialist does the entire workup for the
Hello.
about hello.
Yeah, please.
Yeah. So they will able to decide about the optical and non-optical devices, which is decided by the low vision specialist. So visual rehabilitation professional has a specific role in each particular devices, how to use it,
Okay.
to implement, and how they can able to use in daily task about the reading or the distance or the specific self-help skills. So such kind of a devices can the practice or the training will be given by the visual rehabilitation professionals.
Okay, thank you. Thank you, Yogita. I think you clearly said what is the role of an low vision specialist in Indian context and what is the role of a vision rehabilitation professional. Dr. Vijayalakshmi, you want to add anything specific, ma'am?
Yes, because a child with low vision will need to be educated and need to be taught mobility skills. So for
Okay.
education, they may have to adapt certain, even the curriculum need to be adapted, and
Okay.
also they have to be taught how to move around. So what is called orientation and mobility has to be taught. The communication has to be taught. Then the use of different ICT devices have to be taught. So
Oh,
this is done by the rehabilitation professional.
okay.
The whole life approach, when
Oh,
he gets go for a job, that place has to be modified. His house has to be modified. And then when he is going to get married, how he has to behave with his wife, how they are going to lead a life together, and how they are going to earn. So it is a holistic approach by the vision rehabilitation person.
okay. I think thank you. I think it's very clear. I think when we are to approach, whom to approach, and why we need to approach, and that expectations have been very clear now. And hope the audience are with us and they are getting adequate information. Please don't hesitate if you have any such queries. You put in the chat box. We will see whether we could answer those things well. And I think question is very specific to Dr. Kumar Manikvel. I think this question is the patient asked, in my family, it's 3 out of 5 children are having night vision complaints and slowly their day vision was going down. My concern is how do I know whether the next generation will get the same problem or not? Whom to approach for getting the family guidance?
Yeah, thank you, KK. Before I answer the question, let me acknowledge that I have two team members in this program. So I have Dr. Uttara, and she has been helping me in genetic counseling for a long period of time. And she is right now sitting in Hyderabad. And then I also have another individual, Ms. Sugitana Parthiban, and she's in Trinivali. And she is right now actively helping me in counseling people with family history of genetic disorders. So I might direct some of these questions to my colleague, Dr. Uttara, at some point of time of discussion. So, answering the question that 3 out of 5 children have some night vision complaints, with my experience, I'm presuming certain things because we can't interact and ask question, and I might be wrong. Therefore, until we know the lot of details about the eye condition. So the way it looks like is that the child might be having retinitis pigmentosa. Again, it's my assumption. And when you have 3 out of 5 children, again, there could be a possibility of blood-related marriages, which we call as consanguinity. And therefore, the actual question is that whether this will be inherited in my next generation. In this, we actually come to the conclusion of a genetic factor, which we call as the cause by inheritance. And it looks like this family might be having an autosomal recessive inheritance. Again, all these are presumptions. And in such a scenario of autosomal recessive nature, it will not be passed on to the next generation. And as far as the question of whom to approach the family guidance, actually, if you see, I hope the screen is visible, but at the end of the program, we will announce whom to contact. As Dr. KK said, you can approach any one of us who are in this presentation. And I am doing genetic counseling, and my number and contacts are there in the screen below, right at the below it is visible. And there are many things that can be done. We will do when we do genetic counseling. We look at the social aspects like education of the child, and then their future, marriage, and all these questions we will be answering. And therefore, I can't talk too much on this right now because I'll take too much of time and I'll presume a lot of practice. And therefore, you can always approach a genetic counselor. I don't know where this question is coming from and which part of India. And we will definitely guide you. We can do an online counseling as well. And it can be, if you can't afford, we can do it free of cost. And now I am sort of, directing this question to Uttara if she can add anything more.
Uttara? Dr. Uttara?
Yeah, Dr. Kumar has comprehensively answered the question based on the details that are available right now with us, and also the fact that we cannot interact with the person who has posted the question right now. We have been able to only do a speculative, I mean, there is only an assumption right now, but all the points that he said are correct. And based on the location of the patient, who I presume is watching the proceedings, right, the program right now. So based on the location, I am based at Hyderabad, and Dr. Kumar is in Chennai, but we work as a team. And therefore, for any further family guidance and what to do next in order to know whether the next generation will have the same problem or not, there may, depending on the status of the family, we may probably have some indicators that can help us to speculate or to predict the chances of the next generation also being affected. So based on that, we work as a team online, and therefore the patient can be shared with details, the contact details of both Dr. Kumar and myself. And if the patient approaches us, we can work as a team, and we'll be able to help them the best we can.
Thank you, Dr. Uttara. I think for the benefit of the audience, kindly see below there are some contact details. You can contact either one of it. We will try to help you out, or you can go to the website mygenedx.net, so that you can also directly online you can get connected with Dr. Kumar Manikar. I think with this we can go to the next question. This question probably Dr. Bhavani or Yogita can take it. This patient has got glaucoma for the past 10 years, and the doctor is treating, the person is under treatment, and it's the deterioration of the visual function. I think off late the patient finds it to be very difficult to move around comfortably in unfamiliar places, and the person seeks an advice. Maybe Dr. Bhavani?
Sure. So sounds like typically with glaucoma, what happens is you have a slow loss of your peripheral vision. They also typically have loss in contrast sensitivity. So one thing that I frequently hear from patients that tell me is the room feels like it's in a fog, or I feel like I'm sitting in a fog, or I feel like they need to turn on more lights in the room. So one thing to think about is definitely approach your low vision provider and have a thorough assessment of what that peripheral field looks like. A thorough refraction can help, but it's not always a good solution. Refraction is where we determine if you are wearing appropriate eyeglasses that can help focus the light onto the back wall of your eye. Orientation mobility training can definitely help. Addressing contrast sensitivity issues around the house will be a benefit as well. There is no one magic wand that will fix it. I think this will take a team approach, a thorough approach to see what all can be addressed. And I'll let Yogita take over for what I have not covered.
Yogita?
Yeah, I think so. She has covered few of the things, and probably what I can enhance over here is, in terms of low vision devices, probably the reverse telescope can be better for the peripheral field of vision. Of course, that has to be done by the low vision specialist of analysis and workup done for that, whether the child or any person is really getting difference of enhancing the vision for the long distance. Especially for the moving around, yes, orientation and mobility training should be given by the special instructor, and the rehabilitation service for self-help schemes or moving around or like day-to-day activities. Definitely, the rehabilitation specialist people will be able to help the patient in a better way. It's a basically a team approach. So I think so all of us have to connect to each other in the multidisciplinary area, like so that person can be get benefit at one particular problem, like.
Okay. Thank you, Yogita and Bhavani. In fact, it's been reiterated that uh, you be under the treatment of ophthalmologist for your glaucoma, and for your visual function, kindly please approach a low vision specialist. They are there to help you out, and definitely your question on how to overcome the difficulty which you face, especially moving around in unfamiliar places. I think a lot already 3 4 tips have been given, and please try to see you approach your appropriate low vision specialist, and if you need any help, please don't hesitate to contact us. I think the next question to Dr.
KK,
ARM.
I just wanted to jump in here and make a really quick point to note
Please.
that it is extremely important that they continue to work with their glaucoma specialist, because a lot of times they're on multiple medications. And
Sure.
if you cannot see your eye drops, if you do not know what eye drop is supposed to be taken at what time, and if you cannot read the label, then the whole process spirals down. So make sure you're in continuous contact with your glaucoma doctor. Work with your low vision specialist to make sure you can see how you're supposed to take your medications and take it appropriately. And I'll go back on mute.
That's a very important point. Please underline that very important point. It makes more sense. And the next question to Dr. ARM. Sir, the patient has got a diabetic related retinal changes and using thick glasses for reading purpose, probably maculopathy. And my question is how often I should seek eye care with eye doctor help of low vision specialist. It's almost the same type of question of the previous one.
Right. Yeah, very quickly, I think every diabetic must have an annual eye checkup, that is every year. But from the description that this gentleman or lady has sent, it seems that there is more advanced diabetic retinopathy, which is affecting the central vision, as you mentioned by Dr. KK, with some kind of maculopathy. That's why they're using very thick reading glasses. So that's a kind of possibly a low vision aid, a simple kind of a low vision aid that has been given to the patient. So the diabetic retinopathy needs to be seen on the average every 3 months or so for somebody who's got disease. But your treating doctor is the best person to guide you. It can be 2 monthly, it can be 3 monthly, and if things are very stable, it can be 6 monthly or even in rare cases a year. So I think this is there cannot be a standard answer for this, but your treating doctor who's looking after you will be the best person to guide. The second part about low vision specialist is again, I think, if there are some changes or if there is a feeling that things can be enhanced with more frequent consultations or more frequent visits to your low vision specialist, I think the ophthalmologist and the low vision specialist as a part of a team must speak to each other and decide. So I would say at least once a year, but it could be more frequent.
Okay. So thank you, sir. Actually, and the next question actually, the 92-year-old bedridden has been diagnosed to have some age-related retinal condition by the doctor, and the patient wants to get consultation from low vision care specialist, and the patient is from Chennai. Wants to know is there any possibility for specialists to offer the service at our doorstep, and I just say yes, we could do it. Kindly approach if you want care from us, you can kindly approach the below given numbers or the emails. We will try to see how we could really offer the service at your doorstep. Otherwise, you kindly approach your own ophthalmologist. Probably they might also have a similar kind of approach. As a special case, they might come and offer the service at your doorstep. I'm going to the next question. This is the question has got two parts, and probably Dr. ERM as well as Dr. Vijay Lakshmi can add value. My granddaughter is now 2 months old, and I understand that she could not see things clearly. We took her to eye doctor, and they told she has got some developmental anomaly. I want to know what exactly development anomaly means, and what treatment is available. And other part of the question is, any other specialist can help the child see. Maybe Dr. ERM first, and then followed by Dr. Vijay Lakshmi.
Right. I think from the description, it is it suggests that it's a very small child who's just about 2 months, and there is something which is very striking in the eye. Either there are conditions in which the eye does not develop normally at all. It's a small eye. We call it microphthalmos, or there could be a whiteness in the front of the eye. So there are a whole number of things. So developmental anomaly means that the child is basically born with it. It's part of the development of the child. There is some abnormality in that. So that just shows that it is from birth or from the time when the child was in the womb. Now, treatment again depends on the condition. There are some conditions where we are not able to offer much in terms of treatment. Like if the eye itself is very rudimentary, it is very small, it has not developed much. But in many conditions, for example, if the child has a cataract or some other conditions, then there is surgical treatment available. So, a qualified ophthalmologist, and today there is more specialization. Somebody who is a pediatric ophthalmologist may be able to diagnose the condition and advise about treatment, and if some form of a low vision aid can also be given at a later date. So first thing is to determine whether anything can be done to improve. If not, then low vision aids, or more importantly, a comprehensive rehabilitation, which I'm sure Dr. Vijay Lakshmi will speak more on. Thank you.
Thank you, Dr. ERM. Dr. Vijay Lakshmi, can you put some more points?
Thank you, Dr. Sir. Ravindra sir, as you said, we have to see whether the child has a light perception, whether the child is seeing light. And then if they come to our center, we even at 2 months, we are working on them. Even from 15 days of age, after birth, we have a facility to work on, to assess the child development on the vision, hearing, and also muscles, the motor system. So the development may be delayed due to delayed maturation, or due to some cause that has affected the whole brain. And so that is also affecting the eye and the ear also. So what we do is we ask the mother to come once in a week or twice a week to our center, and ask her to actually see whether the child is really seeing light. And we give, the other modalities of sensory modalities are stimulated, because when you give, the motor, sensory, the cognitive part, the socialization, the emotional attachment. When we work on smiles, that is what we call it. We give a lot of sensory input, motor input, and cognitive input, and then language, emotional, and social development. All together, we give it, even if it is a small child of 15 days old. If you bring them, we'll see that the child is developing, the maturation of the brain is enhanced. Once the maturation of the brain is enhanced, the child, if it is not having any microphthalmia or cataract or any gross abnormality of the eye, the child really starts seeing. That's what we found, it's a miracle that is happening, it's a miracle that happens when you give rehabilitation at the earliest.
Okay, thank you, Dr. Vijay Lakshmi. I think the key point you said, even at 15 days after birth, you can definitely handle, and it is really hopeful. And Dr. ERM has reinstated that it is very important that I know what is the real condition, and based on that, we can always do it. And that is a real big hope for us. And the next question, Mr. Vijay Kumar, actually advocate, is there. This question is on, what are the rights of low vision and people who are totally visually challenged individual, especially in India? Vijay Kumar, you are on line. Vijay Kumar, sir? think, meanwhile, I think Mahalingam, can you find out? Maybe we can go to the next question. Maybe we can, once he comes, we can ask this question. Sorry, audience, that we couldn't catch hold of the panelists, probably because of poor network.
Yeah, yes, advocate
Yeah.
will join. He can go for next question.
Yeah, please. Okay. The question, I think, to both Dr. Bhavani and from Indian point of view, Yogita, people wants to know what are the new developments in low vision care, especially I understand in relation to the devices, equipments they want. Probably if you can highlight some of the new developments.
Yeah, sure. So basically, if you think about devices that are available for central vision, if we split it up as central vision loss and devices available for peripheral vision loss, because they're two different things. For central vision loss, you have something from a very simple handheld magnifier all the way up to electronic head mounted devices that are available now. It's a huge gamut. There are lots and lots of options. And the role of the low vision specialist is to connect you or to hook you up with the right devices for the right function. As far as peripheral vision is concerned, there are options where we can put prisms, certain types of prisms, to help you avoid bumping into walls, to help you identify obstacles on your right or your left field. Some newer technology where, especially for those that are more severely to profoundly impaired, there is newer technology where it actually integrates optical character recognition. Basically, what that means is the unit talks to you. So the machine talks to you. The person either wears it on their face like a pair of glasses, or it's a monitor where they stick the paper underneath the monitor and then it takes a picture. Basically, it takes a picture of the printed material and converts it into speech, and then the person is able to hear. So that's where your low vision specialist will come into play to help you get connected with the right kind of device based on your vision loss. Not everybody needs everything. So
okay. I think, thank you. I think two key instruments. Maybe if you, Yogita, can you also share some of the available in India? And there is no harm. Kindly share if there is name to that thing and where it is available. It will be also appropriate.
Yeah, as I said, basically a conventional lens, low vision optical and non-optical devices, being most of the people are familiar about it. But in past a few years, if you can see in technology-wise, there are many devices have been replaced by electronic and digital media as well. So you can say the smartphone or the
Sir,
smart
வணக்கம் சார்
cane,
மகாலிங்கம் பேசுகிறேன் சார்
it is really helping the people because it's more
சார்
of
நீங்கள்
technology
லைனில் போட
based,
தெரியுது
and
உங்களுக்கு
this
ஒரு
young
கொஸ்டின் வந்தது
generation
டாக்டர்
probably
கேகே
very adapting very fast to this kind of a technology based devices, you know.
ஓகே
So
ஓகே
for their day-to-day function, for distance near or any kind of like functional abilities. So of course, electronic devices
ஓகே
plays
சார்
very
ஓகே யா
important role,
தேங்க்யூ
and
சார்
most of the devices are available in India. Of
ஓகே
course,
ஓகே
you need to do
ஆர்
the
ஆர் யூ கேன்
have some,
கேகேட்ட
I mean,
காண்டாக்ட்
you
பண்ணிவிட்டு
have
நீங்கள்
few
வெர்பலாக கூட பேசிடலாம்
distributors who can able to supply, but as it
ஓகே சார் தேங்க்யூ
decides
சார்
again further whether you really need it or not. So
நெட்ஒர்க்
basically, a low vision specialist will come to the conclusion whether the person really going to it's going to make a difference to them or not. So I think so. Nothing is impossible, and most of the devices can do the wonders in electronic and digital media, and probably most of the visually impaired can get benefit out of it.
Okay, I think there are a lot of hope and new technology is coming up. Definitely, think. I will be sharing some new developments. Maybe I'll try to project it later. And the next question, actually, this question probably I will handle. Can I walk around with the telescope on? Actually, a conventional telescope, it is not appropriate because of its optical property. We don't advise them to move around. Probably you can sit in one place. If your vehicle moves around, you can wear the telescope. There you don't mobile. And there are some telescopes which are available based on how you are fitting the telescope slightly above your direct visual axis. That means direct vision seeing area. It's slightly above. Then we can use it your normal glasses for moving around, and for you to see anything specific spot, then you can use the telescope. Otherwise, you can hold your telescope hanging on your neck, and so that you can use on and off as a spot reading, so that you can move around. But technically, with telescope on, like a spectacle, you can't move around.
Hello.
It is not appropriate. I think,
Good evening, good evening.
hope that would have answered your question. The next questions to Vijay Kumar, you are back.
நான் இப்போ ஒரு ப்ரோக்ராம்
Vijay Kumar is there?
ப்ரோக்ராம் இருக்கு அப்புறம் பேசுகிறேன்.
Okay. Since Vijay Kumar is not there, I'm skipping this question. We will go directly to Dr. Kumaramani Kuel and Dr. Uttara. The question is, can you share one successful genetic counseling which transformed the individual and the family at large? Probably patient wants to know some success story so that they understand when they have to really approach.
Okay, thank you, KK. It's a very interesting question, in fact, and we have multiple families where we can tell some fairy tales, very successful. But let me take one instance which even Dr. Uttara will be aware of. And this is actually a family from Kerala which had a history of a condition called retinoblastoma. There were multiple family members having this problem. So retinoblastoma is actually eye cancer which develops in young children below 5 years of age, a very, very rare condition. But we have this problem all over the world. And so this family was from Kerala. And there were about 5 or 6 members who were affected in earlier generations. And therefore, they were feeling that there is a curse in the family. And that is the reason why this keeps recurring again. And they approached us, and they were so scared of even having a child. See, these were a young couple, and the woman became pregnant, and they aborted because they were so scared that they might have a child with the eye cancer condition. So then we did genetic test in that family. We took multiple members, and then we what we call as haplotyped or genotyped all of them. And then we had this lady with the pregnancy, and then she was 7 months pregnant, and we didn't want to do a genetic test even before the child is born, which we can easily do today. And then we can tell even before the child is born whether it will have or not, and accordingly the parents can decide whether to go ahead with the pregnancy or not. But then in this case, after the birth, on the 5th day, we took a blood sample from this newborn child and we tested. And then we found that it doesn't have the wrong copy for this condition called retinoblastoma. And therefore, the parents were quite relieved. The benefit of that is that otherwise, we have to do a repeated anesthetic examination of the eye of the child. And a newborn or a very young child, less than a year old or two, can have various anesthetic risk when they do this examination. Since we ruled out that genetically this child doesn't have this wrong copy for retinoblastoma, the child didn't undergo any kind of anesthesia, but was on surveillance, just a regular surveillance. And then this is a very happy family in Kerala right now. The child must be about 10-15 years old right now. So, Uttara, anything you want to add?
Dr. Uttara, you have any points?
No, actually, I was going to suggest if he was going to ask me which one to choose, I was going to suggest this one because this is a fairy tale actually, and we all were there to witness it right from A to Z. So nothing more to add.
I think that gives a lot of confidence, and many people know when to approach and how it transformed the whole family.
With the advancing the medical genetics scenario right now, much more is possible. Only the one thing that is probably short is awareness, and the kind of programs that we are having in pipeline will possibly help to reach more people and to create more awareness.
Okay. Thank you. I think we will skip these 2 questions and we will go to I think whether Yogita or someone can answer this question. This question was very specific. What are the normal, cheap means very low cost, low vision aids for Down syndrome school going child? Anything specific for Down syndrome?
I guess mainly they have a refractive error, maybe hypermetropia, myopia, or astigmatism. So probably if you have diagnosed in a very early stage, and refractive error can be connected with the conventional glasses or even a high magnifying glasses. So of course, those particular magnifiers, hand magnifiers, pen magnifier, or the spectacle magnifier even, they're quite at a very cheaper rate as compared to the telescopes, or spectacle mounted or handheld telescope. Of course, telescope is going to be a little bit costly affair, but then spectacles and magnifiers can be a very economical rate available in India.
And in fact, I also, when we were dealing with some of the Down syndrome, which is very common, usually we say that around 40 years we used to get what we called the presbyopia, or in Tamil they say Saleshwaram, where you can't see letters clearly at near. We used to say in Down syndrome children, they used to have the similar kind of representation at a young age, as they could not read things very clearly. There we need not consider them as a low vision. All we require to give them a plus lens, they will start reading it. So we call it accommodative insufficiency in their younger age. This is something which I want to add. Probably you can ensure that proper refraction being done and the child doesn't have what you call as accommodation related problem. Maybe if you can discuss with your ophthalmologist and optometrist, probably they can add more value. Maybe Bhavani, can you add if you have any point on this, or we can go to the next?
No, I think you covered it.
Yeah. And this is the question. I am a visually impaired person with RP. I would like to know about the latest assistive technology available to improve my quality of life. I think Dr. Bhavani, you have anything specific for RP child?
Sure. Patients with RP typically have a reduced peripheral field of view. So if it is purely just reduced peripheral field, then reverse telescopes can help. Reverse telescopes are typically used to magnify things. But in patients with RP, we can actually flip it, reverse it, so that use it in such a manner that they can actually get a wider field when they look through the telescope. You cannot use the reverse telescope to walk with, because when you look through it, everything also looks minified. So if you're using a 2x telescope, you will have twice the field of view, but your visual acuity will also go down by twice as much. So we typically like to mount it above the line of sight or off to the side a little bit, so that you're using the telescope purely for spotting purposes, just to look through it briefly to see what's in front of you and what kind of obstacles are there. As far as other things go, one must remember that people with RP can also have swelling in the back wall of the eye. We call it cystoid macular edema. So if that is there in addition to the peripheral field loss, then there'll be loss of contrast sensitivity. So for these patients, addressing contrast will be helpful. Some of these patients also benefit from using portable handheld electronic magnifiers, which actually enhance the contrast for you. So those are some of the newer pieces of technology that can be tried. If they have very, very advanced RP, then a head-mounted system, like I talked about earlier with optical character recognition, is a wonderful option to consider. So there are options that are out there. A bottom line is, don't struggle in silence. Please go seek help.
Okay, that's fine. Thank you, Vachli. Maybe Dr. Vijayalakshmi, can you tell about the procedure to get disability certificate in India?
Yes. Yeah. It is, if it is 100% blind, any district level hospital, a doctor can certify if he's totally blind and give a certification. But if it is in between, then a medical board containing ophthalmologists should be there, and they will certify and will give the certificate. But suppose if an ophthalmologist is not there, then they will go to a hospital where ophthalmologist are available, like it's a government ophthalmic hospital, or will go to, in Chennai, they will go to, Shankar Netralaya. And the optometrist will do the refraction and all the other tests needed, and the ophthalmologist will also see, and they will give the certificate how much is the visual acuity and the field of vision, and whatever problems they are facing will be written, and that will be given to the patient. And the person will come to the medical board where the ophthalmologist or optometrist is not there. Then that medical board containing a doctor will certify that how much is the percentage of disability. And temporary certificates are given for cataract, glaucoma, and also when cataract with intraocular lens, a temporary certificate is given for 1 year. That needs to be renewed by the medical board.
Thank you, I think. Thank you, ma'am. Actually, that's a useful information. And this question is to Dr. Kumaramanikwel. The patient is having RP and nowadays gradually his vision is dropping. Is there any possibility to stop? How about vitamin A for night vision problem? I have two kids as a mom. I could not also able to help them in their studies in this pandemic. I can't send them out for tuitions too. Is there any way to improve any contribution for them? Maybe Dr. Kumar Manikwel, you can tell about the vitamin A for night vision problem.
Yeah. Putra, do you want to answer or do you want me to answer?
What is the procedure to get a disability certificate?
Can one of you answer this question because we are running out of time?
Yeah, Dr. Kumar.
It will be easy. Yeah.
Okay, so you want me to answer only the vitamin A part, right?
Yeah. I think second part I will ask Dr. Vijay Lakshmi if you can answer.
Yeah, unfortunately, this was a very wrong study which was actually done in Boston at the Massachusetts Ear and Eye Infirmary, which was done by a very prominent and very well-known ophthalmologist called Elliot Burson. So he and Ted Reiser conducted this experiment where they took millions of dollars from the National Institute of Health and conducted a study on RP patients where they gave vitamin A, and then they showed that there was some improvement and published it. So this publication came in one of the topmost ophthalmic journal in the US, and subsequently what happened was there was a lot of denial which came, and this article was published in one of the issues of the ophthalmology journal, but subsequently for about a year denial articles came. So basically the point is that vitamin A is toxic. Okay, if you take it without any proper liver function test being done. So vitamin A cannot be useful for RP, and this is very clearly proved. But unfortunately, that particular paper was widely, publicized even by media, and this is a very wrong concept. So RP patients should not take vitamin A, because for RP there are about nearly 200 to 250 genes which are involved in the visual pathway mechanism, and therefore vitamin A is one of them, and therefore universally you can't take vitamin A, and even if the gene defect is there for improper transfer of vitamin A, even there you cannot take vitamin A. Okay, so vitamin A is not a solution for RP.
Okay.
So let me stop there.
Yeah, thank you. I think Dr. Vijay Lakshmi, the second part of the question, how do you think that the mother can be helped?
Once again, can you repeat the question?
I think the mother says that she wants to help the children study, but because of this pandemic situation, she can't even send the children to tuitions. So how do you think that she can?
Yeah, the mothers are helped through online classes.
Yeah.
Even NIPMED is conducting online classes and how to give visual stimulation, how to rehabilitate. Lots of things are happening. Once they have to come to Muttukad, NIPMD, and then register, then they will know where to, how to get connected with the
Dr. Vijay Lakshmi. Dr. Vijay Lakshmi, her question is not that. She says that at this pandemic scenario, she being an RP patient, she couldn't do a lot of her activity on her own. But she wants to teach her own children, but she feels that she couldn't contribute. Probably, I understand you say better let them approach you in NIPMED and take some tips so that we can see how it can be helped. I understand that probably.
Mother has RP, no? Mother has RP. Mother has RP. Okay.
So you advise mother to approach you in NIPMED Muttukadu and try to get some tips so that it will be useful. Hope they can contact you through phone and then you can help them out. Yeah. Thank you. And the next question to Bhavani. This question looks very technical. Maybe the patient has got central opacity. how eccentric techniques come. I think this question came from one of the optometrists who are training an patient. Can you just give a gist, or we can ask them to contact you directly?
Yeah, it's probably better to have them contact me because it'll go slightly outside the scope of this discussion.
Okay. Thank you. I think optometrist, whoever written it, we will just forward this question to Dr. Bhavani, and once she responds, we will answer, or I will ask, you can contact them directly. Next question, I think we will go to Dr. Vijay Lakshmi. The question is is from Nagpur. They want to know, they want to replant their house so that she doesn't fall. Where will I get an advisor? Dr. Vijay Lakshmi, you can help them. The patient is from Nagpur.
Yeah, she needs adaptation inside her house for contrast and all that. So I think in a rehabilitation professional from our institute can really help them. Actually, we have a branch, a composite regional center in Nagpur. And that is NIPMED has got a composite regional center, CRC Nagpur. If they go there, they can get advice for adaptations inside the living, inside the house.
Okay.
Yeah.
I think
they will advise the engineer how to make it.
Ma'am, that is very useful information. I think we have her contact detail. Maybe we will give to you. Maybe you can call her and give the information.
Okay,
or you can send us the information. We will forward those information to.
Okay, I'll send it to you, sir.
Thank you. Thank you very much. That's a useful one. I think these two are very big questions. Probably, I think it required a lot more attention. This boy is from, I think this both the cases from patients, people are from Mumbai, and one boy has been affected in 2013 by a condition called moya and lost his eyesight. Surgery in the brain was performed for this, and post-surgery he didn't regain sight but lost his memory. Over a period with lots of medicine, he has gained some memory, about 75%, and vision up to 25%. To some extent, he can move independently both within and outside the house. He has been certified 75% visually impaired. The person wants to know how this person can be helped in better quality of life. If anything medical available, maybe Dr. ERM can tell, and Dr. JKM too.
I think this essentially it is a loss of vision related to the nerves, to the neural pathway. So it could be a field loss, there could be an element of field loss, there could be an element of loss of central vision. So I think, and since it is a loss of that nature which cannot be actually improved by surgery or medications, I think the patient should be straight away taken and assessed by experienced low vision specialists, and then also visual rehabilitation.
Yeah. So the Moya disease is actually, from genetic point of view, extremely rare disease. Not very well the genetics has been understood, but nevertheless there is one particular gene called RAF213, and that is passed on by females. Not too much of clarity is there, but definitely there is a genetic component.
Dr. Bhavani, do you think that if they approach low vision specialists and they are from Mumbai, maybe they can also approach Yogita, ma'am? Bhavani, can you add? Dr. Bhavani, you are there? Okay, Yogita, can you?
Yeah, definitely. The person is from Mumbai, and we need to, as I said, multidisciplinary approach. So probably once the evaluation is already done and the neuro-opthal can be evaluated and further medication and all the surgery-related history, probably the what rehabilitation services and the low vision evaluation, we can definitely do it in Mumbai. And if required, we can send it across to the National Association for the Blind for the further approach.
Okay. I think thank you for that information. We will send your contact to them. They may be in touch with you. The second question is also from Mumbai. A 2001 born child lost eyesight in 2018 when he was 17 years old due to a head injury. Doctors have told his parents that some nerves are affected and surgery was performed on the brain. He's not able to see anything now. He's totally dependent on his parents even for movements within the house. Yogita, can you give any tips or suggestion to them?
Yeah, I guess so. As for the
Hello,
question,
sir.
probably the
வந்துருச்சு.
optic now may be affected,
Okay, இது
and
நான் வந்து
if it is the
நான்
vision,
display பண்ணிடுறேன் சார் நான்.
of course, the conventional vision,
Thank
I
you, sir.
mean,
Thank you, sir, so
conventional way
much.
the checkup has been done, and
No, no
if
problem, no
the
problem, no problem.
residual
We
vision is
understand the
still existing,
network
if the
problem. Thank you, sir.
perception of
Thank you.
light is there, we do have a hope of with the low vision devices, probably the person can improve further. So, if the person has not done the low vision evaluation, first of all, I will recommend that. Second, the person needs to go to the district or the central state government hospital to get the blindness certificate. And after that, we can do the low vision comprehensive checkup, and the conclusion comes, to the low vision optical, non-optical electronic devices and complete rehabilitation plan. We can plan it out further about the education, the employment, and the orientation mobility as well, because that's the major goal of rehabilitation, to make the person independent. So I'll
Okay.
be happy to guide the person who can feel free to contact me, and I can guide them in a proper manner.
Okay, I think hope people who have sent this question or listening to Mr. Yogita, he is happy enough to help you out, and we will send you the contact details in Mumbai. Hope you can contact, and you still require anything from Chennai, we can always be open for that. And Mr. Mahalingam, you are online. Mr. Mahalingam.
Hello, hello.
Mr. Mahalingam, now I think I understand Mr. Vijay Kumar Advocate has sent his recorded answer. Because of network issue, he couldn't come online. Maybe can you play out the answers for the following three questions?
Yeah, okay.
Yeah,
Blind and low vision persons under the Persons with
yeah.
Disabilities Act is not in any way distinguished from rights of other persons with disabilities. That is one thing. Secondly, the percentage of disability is analyzed, especially in case of low vision, especially in case of low vision, due to the functionality of the rather functional vision. And the second, the rights are right to education, right to employment, and right even not to remove from the employment in case of disability. All these rights are there for the persons with disabilities, or persons with blindness or low vision. In case if there is any specific question, because this being a general question, it will take more than an hour to answer. The entire act has to be reviewed for an answer. And the second thing is that how to obtain a certificate of disability. To be very simple, the certificate of disability can be obtained from a district rehabilitation officer. They have the forms, and a medical board is constituted, and in that particular medical board, which is constituted for certifying the blindness or the low vision, one doctor should definitely be an ophthalmologist, and other doctors who are connected with disability or any other medical professional can be on the panel, and that medical board can certify that the person is a blind or a person with low vision. And the third question is that whether a 6-year-old child, how to educate. See, there are two ways of doing this. There is a blind special school for the blind. If I don't know if the child is of a low vision or child is of totally blind, but there are two ways of doing it. One is blind school, and the second one is
integrated education. Therefore, these two things can be followed for sorting out this problem. In an integrated education, especially nowadays, there are special teachers appointed to take care of the needs of the persons with disability, in particular, the person with blindness or low vision. Thank you.
Thank you. I think that comes to the end of this session because we are already reaching the time, and definitely I know there are many more questions. Please don't hesitate to ask all these questions. People whose questions are not been answered, kindly contact our contact number, which is given below in each of the slides. We will be in a position to answer that. Because it's already time, it will be very difficult to take up all the questions. Sorry for that, and may I now request.
KK, 1 minute.
Yes, sir.
Because a lot of people have vision problem, you
Yeah.
can keep the contact
Yeah.
so that they can be aware of it. So you can once read it.
Yeah. I think you can. People who are comfortable, I think you can come to our the contact number. Can you note down?
I
97.
I will display the contact number now.
Yeah.
But still, some people cannot see. Therefore, I let him mention it.
I think Mahalingam is reading out that.
I will share the contact details now.
Thank you. Definitely. Thank you, Mahalingam. Can you just give the vote of thanks? And thank you all audience for wonderful listening and wonderful questions. And the panelists, very much thank you for the patient answering. And I would like Mr. Mahalingam to give the vote of thanks. Mahalingam?
Yeah, good evening to all. Thank you very much for all the panel members, starting from Dr. E. Ravindra Mohan, ophthalmologist, Dr. Bhavani Iyer from USA, Dr. G. Kumar Manikvel, Dr. Krishna Kumar, Ms. Yogita Rajkanti, our advocate Dr. B. Vijay Kumar, Dr. Vijay Lakshmi Madam, and Dr. Uttara for her invocation, Ms. Sukirtana, and I would like to thank all the participants participating from various parts of our country, and students and the parents for attending or sending their questions for a discussion with our panel members. And some of the questions from the YouTube channel also, and what are the questions is not able to answer here, we will send the form of email reply to them if they contact through our email or WhatsApp. Once again, I thank all the members for the panel members and all the participants. Thank you very much.
Thank you.
Thank you, sir. Thank you.
Thank you very much.
Let the faculty be there for another 5 minutes. Maling, you can discontinue the YouTube.
Yeah, okay.
KK?
Yeah.
Any comments like whatever that we should have done better? Or maybe quickly anyone can comment. The faculty.
Sir, Dr. Ravin, ERM, sir.